Hi, and welcome to Healing Peak Regenerative Medicine's Longevity Channel. And today we're going to talk about seasonal allergies. I think it's more important now than ever to understand your seasonal allergies and how do you take natural measures to get rid of them, to decrease sneezing and stuffy nose. And this is a pretty big topic for everyone because how do we deal with COVID-19 and having these extra allergies? And if you're sneezing a lot and you're a carrier, then you could be more infectious for other people and that sort of thing. And, I'm really loving the questions that I'm getting from people and the critical thinking that people are at. My patients are coming in and saying, oh, well, what happens after the curve is flat? What is COVID-19 just going to be gone? What do we need to be concerned about? How is this all working? We get the flu every year. So is this something we're going to have to do every year? Is this lockdown for COVID-19? And, we're still working on all of that information and all those answers, and virologists and epidemiologists and all these scientists are still trying to figure out how this virus works and how what it means for us in the future. Right now, we're just trying to not overwhelm the medical system while we learn more about the virus so that we can either come up with a vaccine or, come up with better ways to cope with this type of situation. And so in the meantime, we should be focusing on how do we increase our immune function and how do we maintain high immune function? How do we make sure our immune system is functioning well and correctly? And part of that right now is through seasonal allergies. And so how does that work? Well, your body is having an overreaction to your environment. Pollen is causing your immune cells in your sinuses and lungs to say, this is an invader. Like it's kind of acting like it's a virus or like a bacteria or something. And so you're having a histamine response from the body having an inflammatory reaction to something in your environment. And the number one thing I see affects seasonal allergies from the environment more than anything and decrease your symptoms of environmental allergies is actually eliminating food allergies and food sensitivities. Food allergies and food sensitivities also cause an immune reaction in your sinuses and can cause congestion and sneezing and hay fever or just an increased inflammation overall in the body. And if you lower that inflammatory load in the body, we can't control what pollen is in the air, right? But we can control decreasing our food allergies and our food sensitivities. And that will drastically decrease the reaction your body has to the environmental allergies if you still even have a reaction. I've seen in a lot of cases people who report having seasonal allergies, even though, the pollen load is high and they are affected by the pollen. But when they get rid of their food allergies and food sensitivities for about a year, the next year when seasonal allergy season comes, they're like, I don't have any seasonal allergies anymore, weird. And part of that is because they have a low inflammatory response to their environment, and so they may not be getting above that threshold to cause that inflammatory response. And also, the immune system is functioning better because the immune system comes from your digestive tract and lungs. And so when the immune system functions better, then you may not have those seasonal allergies anymore as you progress through life. And so it's really important to address food allergies and food sensitivities when you have a lot of seasonal allergies, first and foremost. And then after that, there are some things, some vitamins, stuff that we can do to help kind of get rid of them. And I just want to go over some quick tips today. If you don't have access to a naturopathic doctor or you can't get your food allergies and food sensitivities tested or don't know how to deal with all of that, some quick tips to help reduce the amount of sneezing and sinus congestion and stuff that you have. If you have seasonal allergies right now, you should 100% be wearing a mask because if you are a carrier for COVID, then, you're sneezing, even though you don't have the COVID infection or symptoms from the COVID infection, then you could be spreading it widely. And so you definitely want to be managing those symptoms really well, just on the off chance that you're one of the people who are carrying the virus. So Number one, wear a mask, especially if you have seasonal allergies, just to protect yourself and other people. And then number two, if you're outside for quite a while or you're gardening or whatever, just take a quick rinse in the shower after you have been out in the yard or the garden or running or whatever, and get that pollen off of you right away. That will help, make sure that as you continue to go in and out of doors, that it doesn't really have a chance to set in. And then the other thing you can do is you can supercharge your shower with some eucalyptus or some, menthol like peppermint, rosemary, thyme, all of those types of essential oils. Just make sure they're from a reputable source and they're sourced sustainably, because there's some issues with essential oils and how they are made, because they use a lot of herb to make them. And so you really want to get it from a sustainable and reputable source that's making high quality essential oils. But after all that, you can put that in your shower. So eucalyptus, peppermint, spearmint, anything to really open up those nasal passages and cause, that mucus to drain would be really great, so then you can blow your nose and get all that stuff out of there while you're in your bathroom, wash your hands, and then you're good to go, right? Another one is nettle, stinging nettle, absolutely. Stinging nettle tea. Typically, there aren't a lot of contraindications with any of the things that I'm suggesting on this video, but still do check with your doctor. If I'm not your doctor and I haven't okayed you for any of these, therapies, then check with your doctor and make sure that they're okay with you doing some of these natural therapies. Obviously, showering after you come in from outside is fine, but when I'm suggesting breathing in anything or taking teas or whatever, occasionally those can have some contraindications, although I'm not really discussing any of those today. So yeah, that's just my disclaimer. And so we've covered, taking a quick shower. Neti pots do work if you're used to them and you've used them before there and you know that they work for you, great. I kind of am on the fence about neti pots because I think they can be used incorrectly and with the wrong solutions. So if you are an avid user or you know someone that can help you with that, do it correctly, then go for it. And then a couple of other things that you can do is, any type of immune modulating vitamin or supplement, fish oil, probiotics. Obviously, you need to make sure that you get these, again, that they're high quality supplements. If you're my patient, I'm happy to set you up with some high quality immune modulating supplements. So please call us and let me know, what you're interested in, why you're interested in it, or if you need a food allergy or food sensitivity test to kind of help with some of this immune stabilization, then we will get you on our books. But in the meantime, for those of you that maybe are not in Washington State or just kind of need a little bit of extra help, an air filter is huge for your environment. So especially in the bedroom, even during even if it's not like dust mites or something like that, pollen gets in your house, right? And you're spending a lot of time in your bedroom, hopefully getting good sleep. And so you need clean air in there because you're spending so much time in there. And so you don't want to, be getting up in the morning and having these like very inflamed sinuses. That's definitely an indication that through the nighttime, either, so you're getting something breathing in your air at night that's like causing this inflammatory response to happen. I hear this all the time. I get up in the morning and then I just like need to empty my sinuses and I cough and I sneeze and all this stuff, right? So vacuum at least twice a week or dust at least 2 to 3 times a week. Change your air filters in your furnaces twice as often as they tell you. If you have centralized air, make sure you're doing that regularly. It's really, especially during high pollen counts or high pollution times, the furnaces are not accounting for that, or when they're recommending you change those, they're not necessarily accounting for that. And so it's just a good practice to be changing those twice as often as it's recommended to do. So that's another little tip. So we've covered showered, we've covered steam inhalations, getting that mucus out of there. The other thing you can do if you know someone who does acupuncture is very effective for seasonal allergies and immune modulation. And so if you need, a quick way to get that under control and you've done the little things that I've discussed on this video, then that's a really good thing to do if you know an acupuncturist. Say, hey, can you help me get this sinus issue under control? And most of them do know how to do that. So set up an appointment with your acupuncturist and get some help with your immune system function. And some of the other things I've discussed that help with COVID-19 also help with modulating immune function and stabilizing mast cells. Mast cells are the cells that release the histamine, and there are vitamins that help stabilize those cells so they don't have as big of a response to or they don't release as much histamine as they normally would if you're doing things like vitamin C and zinc and that type of thing. So just kind of take home messages for seasonal allergies. Definitely they could be causing an increased spread of COVID-19, so it's really important to get them under control. If you don't want to take Zyrtec or Claritin or one of those over-the-counter antihistamine medications, then the things you can do is shower often, rinse out your sinuses, steam inhalations either in the shower or over a pot. Obviously, take it off the stove. Don't burn your face. Put a towel over your head. Take some deep breaths in with some nice essential oils that open up those nasal passages after you come in from outside, before you go to bed, those types of things. And then make sure you're filtering your air in your house and that your bedroom is nice and filtered with clean air. And get those vitamins and nutrients on board that help modulate your immune system and that help stabilize those mast cells so they don't have as big a reaction to the outdoors. If you have an acupuncturist or a naturopathic doctor on board, then they can also help you, especially if you have severe allergies, to stabilize your immune system and to assess what your food allergies and food sensitivities are and get those out of the way. And then, you may not ever have seasonal allergies again. So that's just, treating from the root cause. That's what naturopathic medicine is all about. But in the meantime, zinc, vitamin C, as long as they're not contraindicated with your other medications, lots of water, and, there are some other more higher intervention immune modulating medications for mast cells that I'm happy to suggest if you set up appointments with us so that I can legally give you an actual treatment plan. So if you're interested in that, please call us at 206-899-6000, and we are here to support you and to help you through this time. So just let us know what you need. Please share my video and like my channel or subscribe to my channel so you get updates when more videos come. We do try to email you and let you know when they're out there, but it's not always possible to reach everyone that needs this video. So if you could just share it for us, that would be great. And thanks so much. Have a great day. Bye.